Hi, my name is Dr. Laurie MacCallum, and I'm very pleased to introduce our manuscript entitled An Interdisciplinary Participatory Design Approach for Developing a Usable Self-Assessment Tool for Patients with Atrial Fibrillation. We decided to focus on atrial fibrillation, which is the most common heart rhythm disorder. Atrial fibrillation causes significant morbidity and mortality. In fact, 1 in 6 ischemic strokes is caused by atrial fibrillation, and 1 in 4 in the elderly. In a recent study looking at patients that were admitted with a stroke and who had atrial fibrillation and who were candidates for anticoagulation, 60% of them were not receiving anticoagulation. And of those who were taking anticoagulation, 39% were subtherapeutic at the time of the stroke. So our approach in addressing this care gap in atrial fibrillation was really to focus on patients themselves. And we decided to focus on 2 areas. One was symptom management, which can greatly impact a patient's quality of life, and the other was on stroke prevention.
One of the things that's unique to this project was the interdisciplinariness of our team. So we had a design team as part of the project, and that allowed a different lens and perspective to come into the development of the tool.
You can see that it's very colorful and engaging. It opens up with the purpose of the tool and the objectives in very simple language so the patient can quickly see the relevance and proceed to complete the self-assessment quiz.
By incorporating design and human-centered design practices into the beginning of the project, we were able to keep the focus on the patient and the end user.
Know Your Colors, though, really helps us to follow our patients. So for those that have had atrial fibrillation for some time, it encourages us to have that conversation about how their symptoms are doing and are they on the best medication for stroke prevention.
Now, the self-assessment quiz is based on determining the CHAD score for the patient and their risk of stroke and the appropriate therapy that they should be receiving. The other side has to do with symptom management and how it's impacting on their quality of life or leading to unplanned visits to their doctor or emergency room visits. But it's all distilled down into very easy to use patient language. Based on the answers to their questions and the therapy they are receiving, they are given a result that is either green, yellow, or red, and with specific instructions on what to do with that result.
So along with the tool that was provided for patients to bring to the family doctor, we also created a letter that explained to the physicians what the patients were bringing. And just as an added benefit, we had an atrial fibrillation in 1 page, or AFib in 1 page, that we provided to the family physicians.
All of this is based on the Canadian Cardiovascular Society guidelines for the management of atrial fibrillation, but distilled down into a very digestible format.
Future research with the Know Your Colors tool involves looking at patients who have brought this tool to their family physicians and then seeing if it's actually made a difference to their care. So the first thing we're looking to see is of patients that came in, spoke with their family physicians, does it change if they're being treated as per the 2012 Canadian guidelines for atrial fibrillation. We're also looking to see what the usability is from a patient perspective as well as a provider perspective. And lastly, we're looking to see if the documentation of atrial fibrillation increases now that patients are bringing the form to their physicians and starting that conversation.
By incorporating patient input together with human-centered design and the knowledge, experience, and expertise of healthcare providers that care for these patients, we can develop tools that more effectively meet the needs of patients and hopefully improve clinical outcomes.